Nursing homes and long-term care residents and staff have to be tested for coronavirus. It was supposed to be done by the end of this month, but new this afternoon, the date has now been changed. News 4's Alexandria Adams is on top of the story. Let's talk about the new timeline for when facilities have to have this done.
Yeah, Lauren, this new date is set for June 30th. I reached out to the Unified Command Group earlier today, and they sent me this statement on the reason why. They say, quote, it allows enough time for those long-term care facilities with testing in progress or scheduled to complete, and allows other facilities to plan their testing and consider what resources or support they might need. Now, if these facilities choose not to comply, they could face some very heavy consequences.
The governor's Unified Command Group says nearly 40% of COVID-related deaths in our state have been long-term care residents. At least 23 patients from a Gallatin nursing home died after an outbreak hit the facility in March. On Wednesday, the Healthcare Facilities Board unanimously approved new rules from the Department of Health requiring the testing for both staff and residents of long-term care facilities. Under the rules, each nursing home has to complete an intent to test survey prior to June 1st. According to the state, nearly 100% of those facilities have completed the survey. 60% have already completed or scheduled testing for staff and residents. And there could be heavy consequences for those facilities who fail to comply to the new guidelines. In a statement, the governor's office says, quote, the department may seek any remedy, including but not limited to license revocation, license suspension, and the imposition of civil monetary penalties. David DeLoach's mother is in a nursing home. While there have been 0 cases at his mother's facility, he says he's in favor of the testing at all long-term care facilities.
I do believe it's prudent to focus on these people and do what we can to ensure the containment of the virus is maximized. It's a case of an ounce of prevention is better than a pound of cure.
Now, residents and staff do have the right to refuse that testing, but they do have to sign documents stating that they refuse the testing. If you would like to read that full report, we have it up and available for you over on the News 4 app as well as WSMV.com. Lauren.